My name is Dr. Charlotte Dando, and I was fortunate to receive the NIHR Pre-Application Support Fund Award for 2024 to 2025. I'd like to take this opportunity to share some reflections on my experiences and the key learnings gained through this initiative. By background, I am a podiatrist with expertise in musculoskeletal ultrasound imaging, foot health service innovation, and health systems research. I've led the integration of musculoskeletal ultrasound imaging into podiatric services and undergraduate education. My work focuses on foot health inequalities and evidence-based foot and ankle rehabilitation. I actively mentor early career researchers whilst contributing to research ethics and journal review. My leadership development and public engagement efforts support the translation of research into practice across diverse health communities with the aim to provide knowledge for patients and the skills and training development for the health workforce to support people with foot pain. My work, specifically within the private practice sector, led to the development of an innovative, digitally enabled approach to capturing the patient journey from initial assessment all the way through to treatment and follow up. This involved designing and implementing database systems that support personalised and inclusive care pathways. These experiences scored the importance of adaptability within the health service and responsiveness to evolving patient and market needs. Through this work, I identified a consistent challenge across both private and NHS settings. The challenges were the need for timely access to appropriate care, clear communication using accessible language, and the provision of meaningful choice. These insights have shaped my research focus on designing, implementing, and evaluating care pathways that better address the diverse foot health needs of the population. The NIHR Pre-Application Support Fund provided an ideal opportunity to pursue this interest. It offered protected time, resources for patient and public involvement, and the infrastructure needed to begin developing a competitive application for funding. During the 12-month award period, the protected time and NIHR infrastructure were instrumental in supporting my decision making and planning for the future funding application. This included gaining a deeper understanding of the NIHR strategic vision and their funding priorities, as well as engaging with guidance specific to the award I intended to apply for. The time afforded by the award enabled me to critically review and analyse the evidence I'd already gathered, which strengthened the foundation of my application. This process helped me to identify potential or particular challenges early on. Through collaboration with NIHR support teams, my academic supervisors, and wider networks, including patient and public representatives, I was able to explore solutions to issues such as workforce training, recruitment strategies, accessibility, and data collection methods. Importantly, the award provided valuable thinking space to refine my research vision. I was able to draw on learning resources and webinars afforded through the ARC and NIHR, while also contributing to the NIHR community through meetings and mentoring opportunities. These experiences shaped my research direction and helped me to identify key training needs. By the end of the award period, I had developed an application for funding. I now have a clear and focused research vision, along with a plan to support others through the research cycle. I also see opportunities for collaboration and teaching that could further enhance research in foot health. On this slide, I've captured the pragmatic steps to pulling together my application. But when reflecting on the key learning points from this experience, 4 things stood out immediately. The first was to make use of the available expertise. Do not hesitate to draw on the knowledge and experience of research support services and your supervisors. I asked countless questions throughout the process, and their insights, shaped by years of experience, were both inspiring and invaluable. Secondly, I planned with structure. I identified key dates early on to help me manage my workload effectively. It also allowed me to anticipate when to share work with the team and where I might need additional support. Using a Gantt chart was particularly helpful in keeping me on track and aligned with project milestones. Thirdly, I had to give myself permission to think. One of the most challenging aspects was allowing myself the time and space to engage with the webinars and workshops. The flexibility provided by the award made this possible. Initially, I experienced imposter syndrome and a sense of guilt for stepping back from doing to reflect and learn. But this quickly shifted as I recognised the value of creative thinking and professional growth. The fourth, I think, is to embrace reflective learning. This experience reinforced the importance of reflection in shaping research ideas and identifying areas for development. It reminded me that learning is not only about acquiring knowledge, but also about creating space to be inspired. So I wish you guys the very best with your application, and I'd also like to take this opportunity to express my sincere thanks to the NIHR, ARC and the University of Southampton for their continued patience, kindness and support. Their guidance has been invaluable. Thank you for listening.